Hi, everyone. In this segment, I'd like to talk a little bit about hygiene and some of the things that I do to help Stephanie to stay healthy. One of the first things is I have been brushing her teeth now for about 18 months. When when I took that over, I realized that first off, it's pretty difficult to brush somebody else's teeth and feel like you're ensuring that they're getting clean enough. So I decided that I would do a couple of things. The first thing was I got a soft bristle toothbrush that would the bristles were far enough apart that if it picked up a particle of food while it was in her mouth while I was brushing, that particle of food would come out fairly easily from the toothbrush. I also decided to start taking her to the dentist on a 3-month basis for cleanings. So instead of cleanings every 6 months, I take her every 3 months. And yes, I have to pay for those out of cycle cleanings out of pocket. But I feel like her oral hygiene is much better because we are constantly seeing the dentist and the hygienist at a more frequent interval. One of the things that we're watching right now is a cavity that is developing in the upper left of Stephanie's mouth. One of her teeth has a cavity that is not causing any issues at the moment. And the dentist has said that he doesn't believe that it will cause any issues as far as pain and things like that. But we continue to watch it. We take an x-ray every single time we go in to see if it's grown and to see if we need to do anything about it. Honestly, the last thing I want to do is have to pull that tooth and have an open socket that she might stick her finger in her mouth and try to pick at it and cause it to bleed and not heal properly. I also don't want her to go through the pain of having to get all numbed up, open her mouth, and having him drill for a while and then pack a filling in there. She has never liked the dentist, and she's had a couple of bad experiences, very traumatic, I would say, and she just doesn't like it. But she does really good with the cleanings. And sometimes I have to put my finger in her mouth and hold it open a little bit so the hygienist can get in. Other times, it's like clockwork. She just does it. She holds her mouth open and allows the hygienist to get in there and clean. One of the things the dentist recommended was a prescription strength fluoride toothpaste. So that's what I use on her. Now let's talk about urinary tract infections, their prevention, and constipation and its prevention. First off, as far as hygiene is concerned, it is of utmost importance that you maintain the highest standards for the cleanliness of your loved one. If they're still able to wash themselves and to keep themselves clean, to take care of things when they go potty, then you should at least be checking to make sure that they are as clean as they possibly can be. Urinary tract infections and constipations, just issues with the bowels, are things that are very, very common in dementia patients. And as they progress, as they continue to decline, it can only get worse. My personal opinion is part of that is because it's someone else having to take care of them. Now, I am Stephanie's full-time caregiver. That means I don't have any excuses. I keep her as clean as possible all the time. That also means that because she's incontinent, I check her often to see if her depends is wet. Now, we also have a very loose potty routine where I take her back and forth to the toilet several times during the day to prevent her from actually wetting in the depends. If you leave someone in a depends for a long period of time, that in and of itself can cause UTIs. And it's just not a good thing as far as their cleanliness goes. Constipation, same thing. You don't want them to sit in a soiled Depends for any given length of time. And those two things, again, can become worse, get worse, as someone declines and as their incontinence becomes more and more frequent. Some things I do for prevention. For UTI, I put cranberry powder into Stephanie's drink every morning. Cranberry is great for trying to prevent UTIs and to maintain urinary tract health. I also give Stephanie a probiotic that is good for gut health, but it also includes things for urinary tract health. And some of these things I'll just include as pictures at the very end so that you can see what I'm talking about. And most everything I just get off of Amazon. Now, as far as the constipation goes, I have a regimen where I give Stephanie prunes, the probiotic that I was talking about. She has Miralax every morning, and I try to feed her things that I know that are not going to constipate her. Those things are key. Think about diet. Think about gut health. Think about how the gut is going to then impact the bowels as things move through. You want things to move through. You do not want them to induce diarrhea all the time, of course, but you want them to maintain a regular schedule for pottying. Something that I've had to do over time is determine what works best for Stephanie. Now, I listed a whole bunch of things, but within those things, I've had to add Miralax, take Miralax away. I've had to start with half a prune, work up to a prune, and we're currently doing 3 prunes a day. And those things will change over time. As a matter of fact, I had just recently gone up to 3 prunes, whereas I was at 2 for probably about a year. One thing about prunes that I'll mention, you want to ensure that you get prunes that don't have any preservatives in them. Preservatives are what cause an individual to have gas, which can also make them potentially expel some fecal matter. So try to stay away from the preservatives. My preference is organic, not sweetened at all. No preservatives, no artificial sweeteners, no natural sweeteners, nothing. Just a prune. And that seems to work pretty well. Incontinence is more than likely an issue that you're going to have to face over time, especially in dementia patients, especially with Alzheimer's. That would be urinary incontinence and bowel incontinence. So let's talk for just a minute about briefs or tabbed briefs. I prefer to use the Depend brief. Now, I had mentioned it earlier. You can use the word Depend as a generic term for all the different types that are out there, but I prefer the Depend brand. And there are several ways you can get them. What I have found, though, is that Sam's is probably the cheapest way to get them, and they'll send them directly to the house for both nighttime and daytime. I found that Costco, only if they're on sale, then you can pick them up in the store for the daytime version. They don't normally carry the nighttime. And then there's also Amazon, and if you use Subscribe and Save, that can save you quite a bit of extra, at least on the first purchase. What you'll find is that nighttime, which is a third more absorbent than the daytime version, runs you a little bit less than $1.10 per brief. And the daytime will run you a little bit less than 70 cents per brief. One thing, though, is that this is also a hospice benefit. Now, they don't provide the Depend brand, at least not normally. They don't provide the Depend brand, but they will provide you with an incontinence brief or a tabbed brief for your loved one. So check into that benefit. A couple of other things that they offer is things like latex gloves for when you're changing them, or a thickener for their drinks so that they don't choke or aspirate when you're trying to give them anything from water, coffee, juice, etc. That's a really nice benefit, because what they do provide is a small container that runs about $25 or more per container. It's a good benefit. The other thing that you could do is you could utilize your HSA or your FSA in order to purchase or pay yourself back for the incontinence briefs for your loved one. Because your loved one is not taking care of themselves, one of the things that you need to pay attention to is skin breakdown that can lead to yeast infections. You normally find those in the folds of their skin. It can be armpits if there's contracture in their arms or legs going on. It could be in the creases of their elbows or behind their knees. If there are other folds of skin in the stomach region or even under the breast, those are areas that can remain moist. And you need to pay attention to that. And if you start seeing skin breakdown, there are medicines that you can use. It's usually in a powder form. It's called Nystop, Nystop. That is a prescription that hospice was able to give to us when I saw some skin breakdown occurring on Stephanie. In addition to that, what I've done is ensure, first off, that she's really dry in those areas after a shower, and then check her more often, because our current schedule is the hospice nurse comes on Tuesday and Friday to give her a shower. I give Stephanie a shower on Sundays. So there's at least 3 out of 7 days where somebody is looking, but it can come on fast if there's any moisture in those areas. So what I do is I also get some of the hypoallergenic cornstarch baby powder. And I use those in those key areas where she is more prone to have skin breakdown. Something I learned from my CNA that she suggested a while back: take a makeup brush and have a small container of the baby powder. And you dip the makeup brush into the baby powder and then apply it, like underneath the breast, in the folds of the skin, in the creases of the arms, and things like that. I have found that works great. Now, you're going to get baby powder everywhere, trust me. But it is so much easier than trying to apply it to your hand and then get it up underneath her breast or in a tight fold of skin, when you can just kind of push the brush up in there and rub it back and forth and apply the baby powder. Here are a couple of the items I mentioned earlier when dealing with constipation and urinary tract health. These are just things that I buy off of Amazon and wanted you to just have a picture of them in case you go looking for them. The organic cranberry is pretty generic. You can find it pretty easily. I just wanted to show you our setup here in the master bath toilet closet. I have the baby powder and the medicated powder. I have some washcloths and some rinse-free cleaning solutions in case I need something a little bit more than just a flushable wipe. I can use those to clean her up. I have both types of Depends. I have some Ziploc baggies, some latex gloves, and flushable wipes. Flushable wipes are fantastic, and I have found that Sam's has the best price on those. May God give you strength on your journey. I'll see you again soon.